part two of reading this book, BioIdentical Hormone Replacement Therapy. Literally, it's a brochure that I'm planning to give away to my patients in the office, but a lot of my patients and followers ask me to read the book for them so they can listen to it here. So I'm recording this 20-minute segments that you can just follow through. It's going to be part one, part two, part three, and so on. Earlier, we read the first couple introductory chapters. We're just going to continue with that. So this is Bioidentical Hormone Replacement Therapy by Dr. Neil Rouzier. He has a full, thick book if you guys want to read it. And we'll just continue with part two. So next chapter is hormone replacement therapy and aging. So the first two chapters were on just kind of introduction, what is hormones, what is biologically identical hormones. That's part one of this video series. This is part two. So hormone replacement therapy and aging. Hormones decline in all people as they age. Many physicians assume this is a natural way it should be. If a younger person were to be diagnosed as having a hormonal deficiency, it will be quickly corrected. However, the same low level in the older individual is considered normal for their age and not something we treat for some reason. Normal is a relative term. No one wants the hormone level of an 80-year-old. But labs report this low level as normal, quote unquote, even though it might be only 20% of the level of a 30-year-old. Researchers from around the world have now shown that the hormonal deficiency associated with age should be corrected to that of a younger person. When patients see and feel the improvement, they embrace it wholeheartedly. It is not until one tries this new therapy and experiences the tremendous increase in vigor that one realizes the harm that is being caused to the body by the lack of these hormones. The added benefit is that it is healthy too. Thyroid, estrogen, and progesterone have been prescribed for many years, but optimal hormone replacement is new. It has become logical therapy to replace and balance all of the hormones at the same time to a more optimal physiologic level instead of maintaining lower to mid-normal levels. This is the difference between optimal hormone replacement in comparison with the standard medical therapy. So basically what we're trying to say, and we'll get into it here in a second, is that there is a medical replacement where we just get the levels to the normal range, but it does not mean you're actually going to feel better. When we do hormone replacement therapy for aging, as in like bioidentical hormone replacement therapy, we're going by symptoms. Are you feeling better? Are you feeling all of those fatigues and headaches and whatever else was ailing you go away? Is the energy level back to where it was 20, 30 years ago? That's what we're aiming for. Don't wait for the levels to be technically below a normal range. Except a low normal level is not optimal, and replace the hormone to a high normal or optimal level. Fortunately, many physicians as well as patients are able to key into the concept of optimal hormone replacement. Over the last 10 years, we have educated more than 1,000 physicians in HRT training courses. This is this doctor who's writing the book, which is great. I'm one of them. More and more medical practitioners are becoming aware of science behind the new preventative medicine. It has been shown that many changes seen in normal aging, including osteoporosis, muscle atrophy, sleep disorders, and decreased sociability, are all in part caused by a decrease in hormones. Aging in men is associated with reduced protein synthesis, decreased lean body mass, decreased bone mass, and increased body fat. I'm sure we all experienced it, like you're doing the same thing, you work out in the same way, you're eating the same way, all of a sudden the muscle is not the same, the skin is not the same, the bones are not the same, things are falling apart. Why is it happening? The body composition changes are consistent with the progressive decline in the secretion of hormones. Replenishment of these hormones to physiological levels, optimal, but within normal limits and not excessive, has been shown to alleviate these age related changes. Much of what goes wrong in old age is the effect of our hormones no longer maintaining the balance that they once did. In fact, the diseases that have become associated with normal aging, such as diabetes, heart disease, and hypertension, high blood pressure, are largely a result of what happens when the correct balance of hormones levels is upset. By restoring the proper hormone balance, immunity is restored, and this can prevent many of the diseases associated with aging process. In summary, research has shown that declining hormone levels can cause many ailments associated with aging, and hormone replacement is the only current solution to alleviate many symptoms. Many books recently written on hormone replacement therapy are filled with testimonials from patients praising its benefits. Many patients are typical middle-aged, healthy people who experience gradual increase in symptoms, such as decreased energy levels, decreased sense of well-being, laziness, and the lack of desire for common daily activities. Patients tend to lose muscle tone, gain fat, around the midsection especially, and experience thin hair, thin skin as part of this process, right? In addition to the symptomatic degenerative problems, they will also experience increase in cholesterol as well as signs of heart disease and arthritic change. Within 6 to 12 months of hormone replacement therapy, patients have noticed reshaped bodies, fat disappearing, increasing muscle tone, and the energy of a younger person. Patients report an improved sense of well being and an improved outlook on life. There are tremendous health benefits. There are great benefits, feel good benefits. By the way, all the people on TikTok, you can follow me on YouTube. I am recording this live on YouTube at IBI Healthcare Institute website or account. So it's linked in my profile. Go there, and after I'm done reading, I will switch back to here and post the recording of the YouTube for you to watch later, as you asked me. So unfortunately, nearly 90% of patients we see who are taking so-called natural hormones from other doctors are on an inadequate regimen. How do we know? When we measure the blood levels, they are near zero. In order for the hormones to be beneficial, the serum hormone levels must be kept within the optimal upper limit of normal levels for a younger person. Most physicians are not trained to target optimal levels. Many physicians do not understand how to prescribe the correct doses. They are not aware of the target optimal levels based on blood tests, not saliva tests. They might not be aware of the many options of compounding of the natural hormones in order to provide a type that is absorbed and metabolized by the individual patient. First and foremost, the patient must insist that the physician explain, monitor, and optimize the hormone levels in order to guarantee that the therapy provides the maximum benefit. So that's part of the program. When we're doing hormone replacement therapy, we'll be checking blood levels to see where you are, and also to see if we're progressing as we're giving you different doses of medications. Are you getting enough? How are you feeling? If we're still not controlling the symptoms, let's change things up. Let's change the doses. Women who go through menopause will notice dramatic changes in the skin thickness, texture, hydration, and tightness. Women who stop hormone therapy notice the same disturbing changes. Literature in dermatology journals demonstrate the loss of thyroid, estrogen, and testosterone hormones are responsible for this detrimental side effect of skin. The only way to treat and prevent the changes in skin collagen, elastin, and prevent wrinkles is through hormone replacement. More importantly, however, are the changes within. The outside skin clearly displays signs of aging, but the inside also incurs significant deterioration that is not visible. This might be the reason that so many midlife women And men say they just don't feel as well as as they would like. So much of this can be helped if treated early. When you go through that high school reunion, you'd rather hear why you look great instead of fearing how much you've aged. How we doing here? Read another chapter? I'll read another chapter, and then we'll save more of the book for next part 3. So for those who are on TikTok right now, I am recording live on YouTube. IBI Healthcare Institute page, which is linked in my profile. I kept going for, so this is chapter called thyroid hormone. So we'll talk a little bit about thyroid hormone. I kept going from doctor to doctor searching for the cause of fatigue and feeling lousy. The doctors always told me that my thyroid was normal, but I knew it wasn't. Thanks to being on the right dose and the right kind of thyroid, I finally feel normal. For those who do not know, there are different kinds of thyroid replacement therapy available, but only one is favored by classic trained doctors, and not everybody gets the second option. Thyroid hormone is a metabolic hormone secreted by the thyroid gland. It regulates temperature, metabolism, cerebral function, which is your brain, which results in increased energy, temperature, and warmth. It increases the fat breakdown, resulting in weight loss, as well as cholesterol levels, so it lowers your cholesterol. It protects against cardiovascular disease by lowering cholesterol. It improves cerebral metabolism and prevents cognitive impairment. It relieves symptoms of thin, sparse hair, dry skin, and thin nails. Thyroid affects every cell in your body. People who suffer from low thyroid function tend to experience fatigue and low energy, slowness in their thinking and actions, forgetfulness, mental confusion, depression, arthritis-like pain, and susceptibility to cold and infections. Many of these aspects are considered normal aging. However, now we know that it is secondary to thyroid insufficiency. The thyroid hormone can be an indispensable component of your hormone regimen. Thyroid production declines as we age, similar to other hormones. This is not considered to be true hypothyroidism, but rather a thyroid insufficiency, which has in the past been thought not to require hormone replacement. Research has now shown that improving thyroid levels will alleviate many of the symptoms of thyroid insufficiency and allow our system to function more effectively and efficiently. So we would compare it to insulin resistance and diabetes. You may have symptoms and problems of insulin resistance without having diabetes. You can have symptoms and problems of thyroid insufficiency without having official hypothyroidism, meaning your labs will look normal, but obviously things are not feeling normal. Thyroid hormone initially is produced in the thyroid gland as T4, like thyroid 4. Once in the body, the circulating T4 is converted to the active form of thyroid called T3. As we age, this conversion becomes less effective. In addition, the production of T4 also diminishes, thereby resulting in less stimulation of the cells. Our body needs hormone for metabolism. If metabolism is low, due to an inadequate supply of thyroid hormone, it will adversely affect every organ and every system in your body. We will have less energy, as well as the symptoms of thyroid insufficiency. In addition, the conversion of T4 to the active form of T3 also diminishes, resulting in less stimulation of the cells. Mitochondria is like a little powerhouse of your cells. Mitochondria needs thyroid hormone to burn oxygen and produce ATP, which is the fuel that runs the body. ATP is literally what we need to make to make energy for our body. If the mitochondria are weakened due to inadequate supply of thyroid hormone, then we will not be able to burn up proper amounts of oxygen, thereby giving us less energy and symptoms of thyroid insufficiency. In addition, we will be unable to keep up mentally and physically as we once did. So a lot of people as we age say, like, my brain is not working the same. I'm foggy. I'm just not feeling the same, right? I used to do all this like 5 tasks at the same time. Now I'm down to 2, barely handling it, right? So that's part of it. Also, our immune system becomes weaker and less effective. Physicians have been hesitant to supplement thyroid hormones largely due to the lack of understanding of the importance of optimal thyroid levels and the relationship to improving the quality of daily life. Over the years, I have seen hundreds of patients that complain of fatigue. Again, this is a book by Dr. Rosier, so that's him speaking about it. But why rewrite something that's so well written, right? So over the years, I have hundreds of patients that complain of fatigue, lack of energy, weight gain, and all the typical symptoms of low thyroid. Every time these patients have been seen by their doctors, they're told that there's no problem and their thyroid within their thyroid and the tests are normal. Patients seems to know that there is a problem with their thyroid, but physicians refuse to acknowledge this. Many patients treated with systemic T4 product or synthetic T4 products will still experience hypothyroid symptoms even though the laboratory test values appear to be normal, according to their physician. This is because the physician tends to rely on one thyroid test called TSH, or thyroid stimulating hormone, which is the indirect measurement of thyroid function. The new paradigm is to measure the free hormones in our body, which is free T3 level. This is the actual active hormone that's supposed to be the functional part of the thyroid. The free hormones are the active hormones and are more accurate indication of the body's metabolism of the hormone. Correcting these deficiencies of the thyroid hormone to optimal levels with natural thyroid results in optimal blood levels, improved metabolism, and resolution of the symptoms. Even though thyroid levels might vary, symptoms might not improve until optimal levels are reached, levels similar to those present in younger years. This is a concept not understood by most physicians, yet wholeheartedly embraced by patients. So, treating the symptoms, not the lab. Novel concept. Just because laboratory values fall within a normal range does not mean the levels are optimal or the best they can be. We believe there is room for improvement. Normal levels for a test are an average for the population. People might be low or high, and this determines normal levels. But normal for middle-aged person is low in comparison to a younger person. Does that make sense? So if you're 70 and your level for hormones is normal for that 70-year-old, well, it's clearly postmenopausal patient. Obviously, it's not going to be normal level for a 20 or 30-year-old. So if you want to feel like 70-year-old, you go by lab numbers. If you want to feel like a 30-year-old, you want to bump your numbers up to start actually feeling differently, start feeling good. So a middle-aged level is just as low as everyone else at that age, rather than optimal for a younger person. Physicians call a normal for your age. Patients call it feeling lousy for your age. By optimizing thyroid levels, symptoms of low thyroid can be alleviated and health benefits assured. Thyroid hormone is in higher doses can be shown to be an effective treatment for chronic fatigue syndrome. It helps patients with severe bouts of low energy. Treatment with optimal amounts of thyroid is the best way to improve how one feels and functions. As for those who are taking thyroid, most physicians prescribed only synthetic T4 medications. Unfortunately, many symptoms persist despite normal thyroid levels. The problem is a lack of conversion of T4 to active T3 version of the hormone. This is commonly seen in patients taking synthetic T4 thyroid hormone. Due to inadequate conversion of T3 to T4 to T3, patients frequently experience low thyroid symptoms even though their doctors report normal TSH and T4 levels. By using a combination of both T3 and T4 in a natural form, optimal levels of T3 are obtained. A recent study in New England Journal of Medicine proved that a synthetic T4 by itself did not eliminate symptoms. It was only the combination of T3 and T4 together that resulted in clinical improvement and resolution of symptoms. We find the synthetic thyroid T4 replacements are not as effective as the natural replacement, which mimic the hormone normally produced by your body. Natural thyroid with T3 is the only way to optimize all thyroid measurements and the levels. Patients who switch from synthetic to the natural usually notice an improvement in their symptoms, similar how the New England Journal of Medicine reported it. In spite of the evidence that natural thyroid is much more efficacious, physicians will often prescribe only T4 due to drug company influence and habit. Thin hair, brittle nails, dry skin are all related to low thyroid. Many women who suffer from hair loss and thin hair are usually told by their physicians there is nothing that can be done. In spite of normal thyroid tests, women often can stop hair loss, increase hair growth, and increase hair thickness by optimizing their thyroid levels. All hormones are beneficial, low levels are detrimental. All right, you guys, so that's my reading of this brochure that I'm going to make all my patients read who come for hormone replacement therapy. This is part 2 in a series of probably 6 parts, 6 to 7 parts. I'm posting it on YouTube. I'm currently recording it live on YouTube. So IBI Healthcare Institute on YouTube. Make sure you click subscribe button and like button and share button to make sure you can get the rest of the series as I post it. And I will see you all later on YouTube. Thank you.